Friends, kidney diseases is a worldwide problem today, and every 1 in 10 individuals are having some kind of kidney problem today. Now, one of the spectrum of kidney problem is called as chronic kidney disease. Chronic kidney disease means a disease which is going to stay with you in your entire life, and you have to deal with it throughout your life. Now, you have chronic kidney disease divided into 5 stages, and the stage 5, which is called as end stage or the last stage, is the stage where you require some kind of support. And what is this support? This support is called dialysis. Now, dialysis is a process in which your work of kidney is done by a machine which may not be as good as the original kidney, but may be as close to the function of a kidney. Now, doing dialysis is sometimes, according to people, is painful. There are a lot of myths about dialysis. There are about lots of saying in the society that if a dialysis process starts, person cannot live or normal life is hampered, but that is not the case. Here I am going to show you a story of our patient Dev Kumar, who is undergoing dialysis for last 7 years and a proper dialysis.
मेरा नाम देव कुमार शाव है। मैं किडनी पेशेंट हूँ। मेरी डायलिसिस 7 साल से हो रही है डॉक्टर बिस्मय कुमार के अंडर में। मेरा 2013 से एक प्रॉब्लम था किडनी का। डॉक्टर बिस्मय कुमार के अंडर में 2013 से हम थे। उनके ट्रीटमेंट में हम 2015 तक हम ठीक थे। 15 के बाद हमको मजबूरन डायलिसिस लेना पड़ा क्योंकि मेरा क्रिएटिनिन कम नहीं हो रहा था। 2 साल तक सर ने मेडिसिन के ऊपर ही रोक के रखा था। जब हमारा क्रिएटिनिन 22 और हीमोग्लोबिन 6 हो गया तो हमारा डायलिसिस चालू हुआ।
Dev Kumar is a 45-year-old man who is suffering from chronic kidney disease for more than 10 years, and he was put on hemodialysis 5 years ago. Initially, he had some problems when he was starting his dialysis because he had some preconceptions that dialysis may stop his life, he may not live long, his normal working activities will be hampered, he may not be earning for his family. But today I will show you that he is leading a normal life. He runs just like a common person, he goes for work just like a common man, he earns for his family just like any other person in the society. But only thing which he does is he conducts his dialysis on time, which is thrice a week, and he takes his medicine on time, and he comes for regular checkup. And that's only the difference between a normal or a common person between a dialysis patient Dev Kumar.
इनको डायलिसिस का प्रॉब्लम था। जब पता हमको तब चला जब इनको वोमिटिंग चालू हुआ तो ऐसी हालत मतलब एकदम सुस्त हो गए थे। एकदम बच्चे की तरह सोफा सेट पे पड़े रहते थे। कोई पानी दिया तो ठीक है, नहीं दिया तो कोई बात नहीं है। जब हालत बहुत प्रॉब्लम हो गया कि एकदम चल भी नहीं पा रहे हैं तो इनको लेके नारायणा हॉस्पिटल के पास गए। उसमें डॉक्टर बिस्मय कुमार उनको दिखाएं। डॉक्टर बिस्मय कुमार को बोले कि इनका तबीयत बहुत ख़राब है, तो पूछा क्रिएटिनिन कितना है, तो 22 था और हीमोग्लोबिन 6 था। तो फिर उसके बाद डॉक्टर बोला कि इनको इमीडिएटली डायलिसिस करना होगा। तो ये सुन के बहुत हम काफ़ी रोने लगे, ये भी घबरा गए।
डायलिसिस के सुन के हम भी बहुत पहली बार डर गए थे, लेकिन 2-4 आदमी हमको समझाया, सर भी समझाया, डॉक्टर बिस्मय कुमार। उसके बाद हम डायलिसिस में गए। 2-3 बार हमको बहुत तकलीफ हुआ। उसके बाद से एकदम नॉर्मल ज़िंदगी जी रहे, हर काम करते हैं, हर कुछ अवेलेबल रहता है, सब कुछ वर्क कर लेते हैं। डायलिसिस भी आराम से हम अपने से आते 1 महीना सिर्फ कष्ट था, उसके बाद से एकदम नॉर्मल सब कुछ ठीक हो।
डायलिसिस पेशेंट डायलिसिस करवाने के बाद बस 1 घंटा रेस्ट कीजिए, थोड़ा सा माइंड सेट हो जाएगा, उसके बाद से सारा वर्क करते हैं, कोई प्रॉब्लम नहीं है। आराम से खा रहे हैं, पी रहे हैं, सारा काम भी करते हैं, घर में मेरा हेल्प भी करते हैं, टोटल काम करते हैं।
Friends, he is our patient on dialysis for the last 7 years, and if you can see, this is a totally painless procedure, and he is comfortably lying down, and this is called a dialysis machine, and here the blood goes into the machine. This is the filter or the dialyzer where the actual filtration process is happening, and the blood crosses this filter. All the urea, creatine, waste product fluid is removed through this fluid, which is called as dialysate fluid, and fresh, clean, purified blood is again returned to this hand, and this is called as fistula or AV fistula, which we advise any patient who is going to go for dialysis at least we try to prepare 1 month or pre-dialysis so that this fistula is ready to be performed during dialysis. Now fistula takes around 1 month to 6 weeks to grow to its best maturity level. So as you can see, he is undergoing dialysis for last 7 years, absolutely comfortable, absolutely painless, totally without any problem. So the thought that during dialysis patients have pain, they cannot take dialysis, they have various misconceptions which is there in the society. You can actually see yourself, he is comfortably doing his dialysis without any problem. So this is how the dialysis is performed.
मैं पेशे से ज्वेलर्स हूँ, सोने चांदी की दुकान है। स्टार्टिंग में हमको 4-5 महीना बहुत तकलीफ़ हुआ डायलिसिस के बाद। उसके बाद से मैंने अपना सब बिजनेस फिर से संभाल लिया। मैं अपने सुबह डायलिसिस में मॉर्निंग में जाता हूँ, दोपहर तक आकर के फिर अपना खाना वगैरह खाना खा करके अपना बिजनेस में ही अपना ध्यान देता हूँ। सुबह से शाम तक अपना सब वर्क करता हूँ। पूरा वर्क हम अपने ही करते हैं, किसी के भरोसे नहीं रहना। वाइफ मेरा हेल्प करती है, मेरे बच्चे थोड़ा बहुत हेल्प कर देते हैं। दुकान जाना आना, बिजनेस करना, मार्केटिंग करना सब हम कर लेते हैं। डायलिसिस में डरने का कोई डर नहीं है।
Whenever a doctor or a nephrologist speak to you and tell you that you require dialysis, the perception is that's the end of life. Things have just stopped after that and there's not going to be any future. But that's not true. If you are starting this procedure and if you do it in a proper way with a proper medicines and a proper checkup, you can have the same life how you used to have before. You can actually eat the same way, probably in some restricted way. There are a certain food which you cannot take during dialysis, but more or less with better protein intake, you can do a good survival. You can actually sleep the same way, you can actually work and earn for your family the same way, and your lifestyle is not going to be no different except for those 2 days or 3 days where you have to take just 4 hours of your precious time and come to our or any unit for conducting your dialysis. Just like any person who is going for a work or a student who is going to school or a man who is going for his job, you have to just give that 4 hours twice or thrice a week for conducting your dialysis procedure and returning back to your life and to work in the same way. So there is nothing scary about it. Life can continue with the same procedure. Living is possible, and living with kidney disease, you have to understand these dynamics of kidney disease.